one of the questions we get to ask people like yourself is, what do I do when I get that diagnosis? So a lot of people will sit at the doctor's office, they'll hear the words cancer, they'll get scared, they'll panic. Oftentimes the doctor will say, look, we caught it in time, we're going to start you on treatments next week, right away. What should the person sitting across from the doctor do at that moment or in those days beyond?
Take your time. Take your time. You know, it takes 5 to 8 years for cancer to have developed in your body. So you do have time on your side most of the time. Do your research. You know, get on the internet, and I know there's a lot of information out there, but look at reputable doctors who have success cases. You know, there are more and more medical oncologists that are integrating and using complementary methods. Look for those types of clinics. You know, talk to people. You know, there's a lot of information out there. Talk to people like myself who've actually have been through the cancer journey and have had, you know, 35 years of experience in the wellness industry.
And we hear this from people like yourself a lot, that there's time. You don't need to rush. Take your time to make a decision. Why from the doctor's end are they saying you got to start now?
Well, unfortunately, you know, that's what they know. They've got the blinders on, and that's what they've been taught. And they're really quick to get people on the, I hate to use the term, but the conveyor belt, you know, load them up and get them in, you know, just to get the process going. Because, I mean, let's face it, the cancer industry is $1 billion a year industry, and there are profits to be made. And every time a patient has chemotherapy, the doctor gets a percentage of that. The doctor gets paid for that. Every time they have radiation, the doctor gets paid. But ask oncologists if they would submit their family and their own self to those treatments. You know, a study done in Canada showed that 75% of oncologists said they would never have chemotherapy and radiation done to their family and onto themselves.